So, shall we start, sir?
Yeah, welcome.
Yes, sir. So, the video will be live streamed in YouTube only, sir.
Okay.
Okay, sir. Humble pranams to the gathering. Welcome you all to this beautiful evening. Let me begin by quoting the inspirational words of Albert Einstein. Life is like riding a bicycle. To keep your balance, you must keep moving. With great joy and immense pleasure, I extend my warm welcome to all the dignitaries, guests, and delegates present here for the AYURCONE 2022, a national Ayurveda web conference organized by DIKSHA Academy under the banner of Ayurveda Ka Amritkal, initiated under the visionary guidance of Indian government. India is marching ahead with the vision of making India a real leader in all aspects. To contribute towards this vision of making traditional medicine more accessible to all during the Amritkal, let's become a part of history marking the golden period of Ayurveda. Today, we are fortunate to have Dr. PADMASHRI Vaidya Balendu Prakash with us to discuss on the topic Ayurvedic management of recurrent acute or chronic pancreatitis. I take this opportunity to introduce Vaidya Balendu sir. Vaidya graduated from Mahashri Dayanand University, Rohtak. He is an expert in Rasa Shastra. Vaidya is the founder of Vaidya Chandraprakash Cancer Research for Ayurveda Research in 1989 and set up a research center at RCC Trivandrum in 2000. Sir has published several articles in Alternative Medicine Research Journal. Vaidya was a former member of Scientific Advisory Committee of CCRAS. Vaidya is the member of Advisory Committee of Herbal Research Development Institute and the Advisory of Cancer Control Program of Ministry of Health and Family Welfare. Sir is the recipient of several prestigious awards like Ayurveda Chandrodaya, Vaidya Ratnam, and many more. The Government of India awarded him with civilian honor Padma Shri in 1999. With utmost pride and privilege, we welcome you to our platform, sir. Before starting the session, I would like to go through few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection first. And if the problem is with an unequipped connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be posted in the chat box. Questions raised will be cleared at the end of the session. Now, without any further ado, we will turn the time over to respected sir to enlighten our minds with his knowledge. Over to you, sir.
Thank you, Diksha. It's my pleasure. Today, I have been invited by youngsters to share my decades-long experience practicing Rasa Shastra. And I'm very happy that hosts are from Kerala. So I born and brought up in UP, but my affiliation with Kerala is long back, since 1984. And I have the privilege to be the friend of Dr. K.R. Narayanan, who was former President of India, whom I met in 1987. And then he was my fan and I was his fan. And for 18 years, association I had him. And then one of the journalists, Mr. K. Gangadharan, who was the man behind my uplift from a wooden platform as a Vaidya from Meerut to the international fame. So these two people of Kerala had been instrumental in transforming my life. The third one, who was the former Education Minister of Kerala, Mr. M.A. Baby, he was instrumental to take me to RCC, where we had a very courageous effort of setting up a clinical research unit of Ayurveda in a prestigious RCC, and where I treated few diseases, including pancreatitis. So some of the data which I am going to share today on pancreatitis, that is also generated from Kerala, and most of the patients who came at time in 1999, they were from Maulana Hospital, which is situated in Perinthalmanna district, Mallapuram. So friends, I had been travel all over the world. And while, again, it was in 97 when I was in France, So I was told by a gastroenterologist that pancreatitis has the highest incidence in the world in Kerala state, in southern state of India. And I was not aware of the fact, but I was getting few patients that time. And then that was the year I started documenting my practice on pancreatitis. I had been doing much work on leukemia also, which is well known. It is pilot studies has been carried. So today I will be discussing on Ayurvedic management of recurrent, acute, and chronic pancreatitis. Before I proceed, I would like to make you familiar what is pancreatitis. Pancreatitis, as the name speaks for itself, is an inflammatory disorder. Pancreas and titis. So wherever there's a titis, orthotitis, it means inflammation within the bones. Tonsillitis with tonsils. So titis means inflammation and pancreas means inflammation to the pancreas. But from where the disease comes? Is it mentioned in Ayurvedic books? So I will say no. The word pancreatitis or Agnashashot, which is later on translated in Hindi, it is never mentioned in Ayurveda because the disease is of the modern age. First case of pancreatitis was found in the world in 1652. And in India, first case was reported in 1937. And then there was more studies. As I said, Kerala in 1985, there was reported case that maximum cases of pancreatitis are from India state of Kerala. What is pancreatitis? What are the symptoms? So the pancreatitis is associated largely, not 100%, with moderate to severe pain in the upper abdomen, epigastric region, associated with nausea, vomiting, backache. That will be the immediate system, and there might be gradual weight loss, extreme weight loss. We get patients who lose sometimes 20 kilo in 15 days. Cystidium means fat in the stool and uncontrolled blood sugar. These are the general symptoms. Generally, these are the symptoms which come to the pancreatitis patient. And who make the diagnosis? Diagnosis cannot be made simply on Vata Pitta Kapha. If you have to make a confirmatory diagnosis of pancreatitis, then it should be done by a gastroenterologist who is not only well versed with pancreatitis, but other disorder of GIT, because it is quite cumbersome and sometimes it is difficult to diagnose a patient of pancreatitis, and the disease is so fatal that sometimes a patient can die within 24 hours of the diagnosis. And there are tests to diagnose. It is not a clinical diagnosis alone. There are imaging like MRCP, ERCP, US, CT scan, and followed by blood tests, serum amylase, lipase. There are other parameters also to know its progression and regression. Like fecal assist test in stool, CA19.9 in blood. These are all the tests which are used in that. The disease nature. What happens if the disease is not treated or treated? So the disease is irreversible, progressive. Whatever the treatment is given, the disease keeps on progressing and fatal in nature. And it is reported that 40% of pancreatitis patients turn into pancreatic cancer, and 90% patients develop uncontrolled diabetes. Whatever you give, insulin or herbal or diet, they never get control of because of the inflammation in the pancreatitis. We don't have the data of India, but the data from America has indicated that 17% patients die within the first 5 years of the diagnosis, 30% patients die within 10 years of the diagnosis, and 55% patients die within 20 years in a country like America. And in my proceeding slides, I will share you what is our data, because we don't have data from Indian government agencies or medical agencies from on a state and central level, but we have our own data which I'm going to share you very soon. So what is Ayurvedic management of pancreatitis? As I said, the disease has no cure. In the Western world, disease is progressive and unpredictable. The patient lives with psychic fear, so they run pillar to post. And gradually, when we treated certain bad cases, in our life. I recall my case from Kerala. There's a lady who was, I think, 37 years old that time, or 37 years old, no, 37 kilo weight. She was very young, and she had more than 67 attacks, and she had a second home in Polana Hospital, Parental. And that time I went to see her, and I brought her from Mallapuram to Trivandrum in ambulance. She was on drip. And then on that drip, the disease, basically, doctor will not give any dairy product. And we administered a medicine called Amar, which I will explain later. It was given in Malai. Malai means upper skin of the boiled milk. So it is incredible. And that lady was given that Malai. And then he improved. And after getting 67 of episode until 1999, then this lady is still alive, did not experience any exacerbation of pancreatitis, and she also delivered 2 babies after that, and she's healthy and happy by all means. And the medicine, which I will explain, it is from Shastra. Now, this is our data. So when the people say the disease is from the South India, but here we have something else to say. 1,500 cases, highest case from Uttar Pradesh. Many people say, since you are from UP, you get highest patient from UP. But I left UP in 1989. I live in Uttarakhand. But anyway, still, I could be considered as UP. But what about Maharashtra? Second largest population which come to our clinic, which is based in the tiny village of Uttarakhand, is Maharashtra. Third is category is Delhi. Fourth is Gujarat. Fifth is Karnataka, Haryana. And very surprisingly, Uttarakhand has more patient than Kerala. Uttarakhand has more patient than Andhra Pradesh. Uttarakhand has more patient than Tamil Nadu. So the disease, my friends, I want to say, the disease is not tapioca. This is not only in South India. Disease is all over. And why it is happening so, which we will discuss visually. And we have presented this data, the changing demography of pancreatitis patient in America, and it has been published. Now this slide again is based on our data of first 1,500 cases, which has been analyzed. That maximum age group is 19 to 45. Middle age. We correlate with Ayurveda because most of the symptoms are Pitta dosha. And not only that, there may be 2 or 3 diseases together, and the Pitta middle age, early young age is Pitta Kal. So we see the maximum, but the disease is there under 11 to 18, but highly prevalent in 19 to 45, and which is the most productive age group. Gender distribution, this data is very similar to the Western data, where we have more male than female, 1:4 ratio. As I said, the diagnosis cannot be made on Mutra Malam Jivadrak Akriti Spashgan. Diagnosis is basically made on imaging, where ultrasound, CT scan, ERCP, MRCP, or blood test, all in combinations are used to make a final diagnosis, which is done by a competent gastroenterologist. This slide is quite interesting. As I recently showed, that 55% cases in America is come to death in 20 years. But what this data shows, that 1,500 cases, only 92% cases were there who had a 10 years history. Only 8% has more than 10 years history. That means in Indian scenario, the survival rate of pancreatitis is quite less. This cannot be conclusive, but it is indicative that 92% patients live only for 10 years. This is very, very interesting slide. People say it's alcohol. But where is alcohol? You can see non-alcoholic outnumbered 33 to 66. Veg or non-veg? We say non-veg and veg. Not much difference. But tobacco, interestingly, non-tobacco has more CP than tobacco. And there is a genetic factor, family history. We see only 6%, 7% has genetic history and 93% have no family history. So this is the entire different observation which is written in the present medical book. And another thing, there's a tapioca. We didn't find a single case here who says that he has come after taking tapioca. So these are the factors which are total contrary to the modern assumption of pancreatitis, where they say Tigaro, toxins, idiopathic, genetic, obstructive, recurring pancreatitis are that. Our findings are very clear that that pancreatitis is more prevalent among those who are non-alcoholic, who are veg or non-veg, who are non-smoker, and who don't have any family history. Here I'm not advocating that people should take alcohol or tobacco or whatever, but we have to find out that rather than focusing on alcohol, we should have to be ready to open up our mind to find other ways of the diagnosis. Now, variants of pancreatitis. Beauty of allopathy. That we have very narrow thing. We say everything is mata pitta kapha. They also say pancreatitis is acute and chronic, but they've elaborated it further. And here I put the name of the pancreatitis has come to us different type. Chronic calcific pancreatitis is almost 1/3 of the total patients. Then chronic pancreatitis, genetic pancreatitis, acute pancreatitis, autoimmune pancreatitis, pseudocyst. So based on their characteristic, modern medicine has categorized pancreatitis into different categories. And depending on the diagnosis, prognosis is declared. But whatever it is, pancreatitis is self-fatal, whether it is chronic calcific pancreatitis or group pancreatitis, necrosis. But the necrotic pancreatitis is one of the most dangerous because it gives immediate fatality. And the genetic pancreatitis is again because maximum patient of genetic pancreatitis convert into pancreatic cancer. What is Ayurvedic treatment? Ayurvedic treatment is about 1 year treatment. Initially, I didn't know. Even I cannot say this is the right duration, but most of the patients do well after 1 year of treatment. And the medicine we use, Amar, it is not a classical medicine. The name is given by the Guru Maharaj, my father, who used to prepare his own medicine using his intuitions, some concept of Ayurveda. And I will show you how we make the medicine. So this Amar is given 3 to 4 mg per kg body weight, divided to 3 doses a day. And these are not empirical doses. These have come after certain experimental and clinical studies to us. There are supportive treatment. Most of the patients with pancreatitis who come to us, they have hepatitis, duodenitis, gastritis, esophagitis, colitis, and to cater that, we have to add PRAK20. PRAK20 is nothing, it's a modified and sterilized form of Punanabamandur, Hingvashtak Chun, Narikelaman, Rason Patti, Kamdudaras, Laman Bhaskar, Bhatrilo, Shavakshar, Patil2, Sushekaras. These are the medicines which are given in addition to Amar, which is the main medicine. And the patient who are deficient in vitamins like B12 and D3, they are giving chemically based B12 and D3. If they have thyroid problem, if they have diabetes, blood pressure, they are also given treatment from the modern medicine. Like diabetes is controlled with sugar, but it has been seen that before Ayurvedic treatment, they take sugar, they take insulin, and with Ayurvedic treatment, when they take insulin, the control is much, much better. And with that, Ayurveda is based on the concept of Ahar, Vihar, and Aushad, right? Lifestyle and medicine. So we give a 3 meal, 3 calories, diet, 3 meals and 3 snacks. And these are about 1,600 to 2,200 calories divided into 3 meal and 3 snacks. And with that, complete physical and mental rest. As I said, the disease is not described into Ayurveda. It can be said it is Udaroga, it is Udarshul, but it is very broad term. But in liver disease, I have visualized the disease is between liver and spleen. So maybe they have categorized the Jakrit Priyavikar. It might be a disease of that, and it is mentioned that such patients should take complete mental and physical rest, and we do that, and we have seen the great impact of complete rest in the recovery of this patient. And here I submit my result at a glance, which we started from 1997 to August 2022. That's 2 months back. So we had 1,500 cases analyzed. Now the number has gone to 1,572, but we have analyzed 1,500 cases and we have 30 deaths. 30 deaths means nearly 2% death rate we have. And we include even those cases who took medicine only for 5 days or 3 days or 7 days, whatever reason, but we have 30 deaths. But we are, we can say that 2% versus 92%. So significant drop in death rate after taking Ayurvedic treatment. There are 12 cases, nearly 1%, less than 1% case said that even after 1 year of treatment, the disease has progressed or relapsed after the treatment. There's the category of the patient who came to Ayurveda, they took medicine, but they never started. And these are about 2.5% cases, 39 cases. We have 11 cases lost to follow-up. We don't know what happened to that. 396 cases have incomplete treatment. They did not complete 1 year treatment, whatever the reason we have. But nearly 60% cases completed Ayurvedic treatment for 1 year. So we will be focusing on those who have completed the cases. And as I said, 259 cases are right now on the treatment. Out of these cases, 768 cases, because there were 753 cases, because of certain deaths, so there were 768 cases. So we have seen the number of attacks. 1 year before Ayurvedic treatment, there are 2,178 attacks in total. But after 1 year of treatment, that number of attack has come down significantly. That is 2,178 versus 169. Nearly 90%, more than 90% patient, 90% lesser attacks, emergency attack. And emergency hospitalization is reduction is more than 95%. So the patient who were getting attack frequent, they were being hospitalized after Ayurvedic treatment. There was a significant reduction in number of attacks and emergency hospitalization. And there was subjective improvement of weight gain in those cases. And when they say weight loss, obesity. So, but what we have seen that the patient gain normal BMI. If they are overweight, they lose weight. If they are underweight, they gain weight. It balances the BMI. So this data attracted the attention of the scientists in the world. And 2 years back, we presented our findings in the 50th meet of American Pancreatic Association and Japan Pancreatic Society in Hawaii in USA. And we were the only person from entire world to take any treatment for pancreatitis other than conventional medicine. And one more thing, the disease is progressive, but Ayurveda says the disease should be cured, disease should not cause any side effect, and it should not get relapsed. So following that concept, we can see that Ayurvedic treatment was given to pancreatitis patient. It brings complete and sustainable relief, which is evident that there are 20 cases who have completed more than 20 years, 5 cases between 15 to 20, 7, 10 to 15, 5 to 260 cases who have completed 5 to 10 years, and relapse and death is only out of 768, 15 means again 2% patients get relapse and death, which I have shown in my previous slide, because no treatment can be 100%. And a patient who get better, they have to follow certain dietary and lifestyle modification, like a traffic rule. If one has to drive a car, there should be a traffic rule. Similarly, if somebody has to be healthy, they have to follow a healthy lifestyle. And Ayurveda stands for regulated lifestyle, regulated dietary. So, patients who follow it, they get 98% complete recovery and this sustainable. There's one more thing about pancreatitis lead to pancreatic cancer. And for that, Western medicine has identified an antigen CA19.9, carbohydrate antigen. And it is a marker to assess the progression of the disease. And if it is more than 300, that is considered pancreatic cancer. And it keeps changing. So, and there's no reference in the world that there can be auto reversal of CA19.9. That means if it has gone up, it will keep on going up. What happens after our medicine, herbo mineral Ayurvedic formulation, we have seen significant reduction in total normalcy of CA19.9 And 148 patients showed that they had elevated CA19.9, ranging from 37 plus to 4 to 10,000. And they have shown reduction in the level of CA19.9 level after Ayurvedic treatment. And this is visible after first 10 days of treatment. And there are only 2.7% cases there who have shown further progression, and which is highly significant to that. So this might be the only data in the world which has shown CA19.9 lowering effect in the patients of pancreatitis, and they have published findings, previous finding, in international journals. Up now we come to that, what is Amar, from where it came. As I said, this is a formula which was developed by my father. It is an incidental thing, but it is derived from the Shastra, a science which deals with the therapeutics of mercury and metals and minerals, which are moderate to severe toxic. There is a tedious process to convert these into non-toxic and therapeutic form. It is not one-day job. It takes us nearly 3 years continuous process to convert these toxic metals into non-toxic form. Here you can see mercury, here you can see copper, here you can see sulfur, and there is lemon, Lapha echinacea, and Clitoria ternatia, which are used in the process of this medicine. When mercury is taken out, mercury is hydrated with copper. When amalgamation is there, it is being Urdupa. And here we are using shivling shaped Urdupatanjant, which is derived by me. It doesn't happen in Urdupatanjant, which is classical equipment. But here this ling shape Urdupatanjanta, so no wastage of mercury in atmosphere, and we get almost that. We do 14 times of distillation of mercury in first copper, and then these plants, which is Akha, Kalihari, Safed Gunja, these are all organic poisons, is done. Then the mercury which is taken, it is considered as Homoshita. Once it is ready, then other side, copper is taken, and with the following the concept of Telam Takre Gavamudre, Amal Ke Chakunat Ke, copper is red hot and pour into sesame seed oil, cow's urine, buttermilk, dal, tripla, 7 times each, and then it is ready. That thing is sulfur. Sulfur is melted with cow ghee, and then it is poured into tripla, and that way sulfur is purified. When we have all this together, mercury and copper are mixed, amalgamated. Then when this amalgamation is ready, then we add sulfur to that, that's kajli. And when kajli is ready, then it is titrated with the juice of devdali and aprajita in lemon, which is soaked for 24 hours. And after that, when it is being grinded in a wet grinder. But what is the optimum of that? So we have incorporated particle size analyzer. That suppose we have a 5 kilo solid material, then we will put 3 liters liquid, and we will grind up to the level when the maximum particles should come down more than 5%, 5 micron. So more than 95% particles should come down to 5 micron. That time it is taken out, it is dried under sun, and then sealed into clay pots. Clay pots are important because they are non-reactive. Especially polished these clay pots, which is shaped in a damru form, the Nalika damru, and where it is put. We are using traditional furnaces. On the other side, we are using computer controlled furnaces, which is based on our data. You can see red and green light. This was developed at our R&D unit in our lab. Based on that, we designed that, and the temperature is between 300 to 400 degree temperature. And this fire goes on. First 12 hours, then 24 hours, 36 hours, 48 hours, 72 hours, and then 120 hours. And gradually, and then we start keeping relating with mercury, and that is called Gandak Jirna. There is a shlok in Rastrani, Same Gandak Jirna. Anigadnashana, Trigune to Visheshana, Maharog Viduruna, Trigune, Veda Smriti Vibradana, Pune, Peshgat Santapnashna, the Setu Chadmuni. When we do Gandak in this combination, usually the Gandak is transformed into geared phase with mercury, and we have done up to 4 times Gandhak Jirna so far with amazing property. When this fire is on, after 72 hours of fire or hours, it is left for self-cooling. And when it is cooled down, this is the down thing, which are available in the bottom of the clay pot. And somebody can call it Tamra Sindur. And the other part, top of that, there is some sulfur, which is sublimated sulfur, which is used further. So this is one cycle. And this solid material is further ground with lemon juice, laphaikinate, and clatodia. Again, the process there, and this process is repeated 100 times. Now, then the Amar, whatever Amar is available today, it is not one day job. The journey which started in 1972, now it's 2022. There was many ups and downs because there was no standardization. Sometimes batch was good, sometimes it was not good. So we have a certain reproducibility by incorporating tools of grinding, tools of fire for the quality assurance, and there's WHO. And this was possible when our state government Department of Science and Program and famous prestigious Institute of Science of Bangalore also participated with us in developing the chemistry of compounds. Here you can see on the one side, we have taken this red color and blue color is copper sulfide and mercury sulfide. And when we do the processing after 50 cycle, there is a different peaks. And you can see 1, 2, 3, 4, 5, 6, 6 different minerals are available to that. This is the ultimate formula of that. So we have repeated 3 samples, and most of the samples are within this range. Today we can see what is Amar. Amar is a complex form of 6 minerals which are converted copper, mercury, and sulfur into this form. Safety is the biggest to do with Ayurvedic medicine. For that, this formulation, Amar, was subjected to safety studies in Institute of Repute, following OECD guidelines. And here you can see acute, subacute study, chronic study. There's only one observation: is no observed adverse effect level. There is no AL, no L, nothing is seen. So at any level, this medicine was not toxic to human cells. Now, experimental study. As I said, pain is not the only criteria. There are other criteria. Luckily, there are few models where pancreatitis can be produced in animals. And one of the things is L-arginine. So we have taken a study with the help of scientists, which is a Mysore-based CRO. They produced chronic pancreatitis and rats. And when they were treated with this medicine, and this lab is well accredited internationally and DIKSHA government of India. And when they did it, it was quite surprising. And these are the details of the 2 studies where different doses were used. That it showed that up to 3 milligram per kg body weight to 6 milligram per kg body weight, this medicine gives the best result. If the dose is less or more, it doesn't work. So it was quite astonishing because this was showing pancreatitis protective properties where there's no other compound who can do it. And it was compared with methyl progesterone, which is known as anti-inflammatory. But here, all the animals which were given methyl progesterone, they died before the study. And scientists made another study because they were skeptical. How come it is such a great result? Pancreatitis protective properties. And the second study was done, and this time margin was less, 4 mg to 6 mg. And that was found that Amar works well between 3 to 4 mg per kg body weight. So these are the findings of that Amar depicts significant pancreatitis protective properties in addition to methyl progesterone in L-arginine induced chronic inflammation in rats. Amar is effective at 3 to 4 mg per kg body weight, and the effect of Amar decreases or increases with the dosing. So these are some additional science to that. Very preliminary, but this preliminary science is important because of that. At least we know what is in it. How does it work? We don't know. What works? We don't know. But at least we know what we are converting to that. And since metals converted to form, non-toxic, because metals can be toxic, minerals cannot. That's Shastra, from the technology to convert these metals to mineral form. Discussion. Pancreatitis is a progressive and fatal disorder, and Ayurvedic disease is able to establish pharmacoeconomic evidence because it arrests progression. It decreases the fatality. So Ayurvedic treatment, followed by experimental studies, suggest that Amar can be a very potential treatment of pancreatitis, especially for protection and treatment. So now, what we conclude, though patients are coming, they are being benefited. Every month we get 20 to 25 new patients across the country. And this is giving us very satisfying model, because when we treat patients, they get better, we feel good. But the idea is to develop the science in such a way that it should reach the masses. So we are on the process of developing this medicine following interdisciplinary scientific approach. Our philosophy is very clear. Evidence is knowledge and knowledge is evidence. We don't care whether it is in the book or not. Whatever we see, we report. We share our knowledge on each and every platform. I'm thankful to the organizers for inviting me on this platform, because everybody is as important to us as a great man, other great men. So I'm glad that you gave me the opportunity. And here I was with my limited knowledge in Ayurveda. That is based on evidence, is knowledge, and knowledge is evidence. We got initially acknowledgement abroad. We were not that much lucky to get acknowledgement from India. Now things are changing. In last 2 3 years, people have started. India, today's webinar is one of the example of that. But it started all in 2018 with America, where we were invited into third international conference on hepatobiliary and pancreatic disorder, Philadelphia, in 2018. So we presented that there. Then same year, we were presented our work in San Francisco, which was in October. Or then next year, it was Jamburi of American Pancreatic Association or Japan Pancreatic Society, where we presented our finding. And these findings were discussed by the group of the people who were viewing the slides. They selected our paper. And when they asked us to explain, they were totally confused. They didn't know what to do. How does it work? What does it work? But it works. So this has been gone to different phases, and it has brought attraction. Many scientists who come to us and they want a ready-made formula. I said, no, it is a conversion of copper into copper mineral. Similarly, it is a disease which converts poison to which is normal cell to killer cells. So there is something great is going on, and if somebody has to understand, they have to do a proper study, and that's why this will take longer time to understand and develop it. We have certain national and international accomplishment. There's a fact-finding committee was set up by CCRS, and they had a professor of gastrology from Medical Institute. They came, they have said it, and they have emphasized that there should be more research on this subject. There's another university, the DB University and Agricultural Technology. Their scientists are very keen to develop this, and they have taken it under a Mission Nobel Prize. Let's hope that their association, active association, is able to cross barriers of university, take this work. I have given certain references. These are available in the slide. So if organizers are there, they can take the copy of this slide, and these are in the public domain. They can share it with the people who will be interested in learning treatment of pancreatitis or giving to their patients. These are all references that are available here. And we also make a publication of our experience. First publication came in November 2014. This is only 47 or 45 cases. Because at that time, patients were coming and going. But in first report has only 48 cases. Then we have first 100 cases, then 255 cases, then 555 cases, then 1100 cases. Based on that, we can say that our success rate is more than 70%. I followed strictly. So that is our finding. And this book, I again dedicated to my friend late K.R. Narayanji, who always said that never ever publish a data to please scientists. Always do something. That also, because it is ultimately it is accepted by science, by the society. That means it is accepted. We also run a social media program, RPT episode, which is on YouTube every month, two times on 5th, 23rd of each month. And this is called RPT. Here patient come because evidence is knowledge and knowledge is evidence. They come, they share their experiences and they leave their telephone number and name and which can be heard. We have recently, so till date, we have published 44. As you can meet the patient, they speak their native language. You can talk to them offline, online, or on personal lines because they have given their numbers to talk. And this is giving momentum. And in the remote part of Uttarakhand, we continue to get at least 1 to 2 new pancreatitis patients to us. And we are very happy. So that we are successful and giving them results. These are further references which has been given here, which contains some Ayurvedic references, which modern references, because our approach is very clear: modern diagnostic, Ayurvedic treatment, and emergency medicine. If they combine together, they can bring a big relief to the patients. So with these words, I say thanks to all of you for listening me patiently. And if you have any question, any doubt, please let me know. With the permission of chair, I would like to say, reply as much as I could do. Thank you very much. And good night to you. And Diwali has gone yesterday. I again take this opportunity to say you very happy Diwali.
Thank you very much, sir, for such an extraordinary enlightening session on Ayurvedic management of recurrent, acute, or chronic pancreatitis. We will now go ahead to the question and answer session, sir. Shall we begin, sir?
Yes, you can.
I request all our participants attending sessions in Zoom and YouTube to raise the questions in the discussion panel. Okay, there is a hand raised, sir. Shall we unmute, sir?
Yes, you can. You are the host.
Yes, sir. Dr. Arati, you can unmute yourself. Dr. Arati, are you there? Dr. Arati?
I'm hello. Hello,
yes,
am I audible, ma'am?
Yes, ma'am, you're audible, ma'am.
Good evening, sir.
Yes, good evening.
So myself, Dr. Aarti, I'm a medical officer in Government Ayurvedic Hospital, Deval Gangapur, which comes in Karnataka state. Just today, one of my friend's husband's CA 19.9 what to say investigation report she sent me through WhatsApp, whose value was 20.83. So is it a matter of concern, sir?
No, 20.83 is absolutely normal. Up to 37 it is normal.
Up to 37 it is normal, sir. Okay, sir. Okay. Actually, she wanted to have she wanted to go for alternative
the thing is, first of all, is she diagnosed for pancreatitis because 20.89 is not a pathogenic state. What are the other symptoms? Why did they do it?
Actually, just today afternoon only she has sent through WhatsApp. I haven't been in contact with the patient.
So I think
And luckily
maybe
I got to attend your lecture today.
so you get all the details, and then you have my WhatsApp number. You can share the details. If it is pancreatitis, we can cure it. Because
Actually,
no
they
doctor,
wanted to approach an Ayurvedic doctor, sir. So can I ask them to approach you, sir?
no, they can approach me. But since you are a doctor, so what I want that you not only refer patient to me, basically
Okay,
you do an internship with me for pancreatitis while living at your home. So first you take the report, make a summary, send it to me. Because no
okay,
doctor
sir.
will do CA 19.9 alone for the diagnosis of pancreatitis. There must be some other test. You go through with that, then you can
Okay,
refer
sir.
the case and you be in the picture all the time from the enrollment till the end of the treatment. Thank you very much
Okay,
for
sir.
joining.
Thank you, sir. Thank you very much. It was a very good session.
Thank you.
Thank you, sir, and thank you, ma'am. Delegates, you can post your questions in the chat box. Delegates, if you have any doubts, you can post your questions in the chat box. No question. Sir, I think that's all for the questions, sir.
Okay. Well, nice to meet you all. And in case you have any doubt, anything about that's related to treatment of pancreatitis, because there's no treatment in Western world, and many Ayurvedic doctors try to use Panchakarma therapy and other therapy in pancreatitis patient because the disease is remaining and relapsing. So sometimes patient is silent for 2 years and again it comes. So please, if you have pancreatitis, it does not respond to the regular mode of that. It is a copper deficiency, copper mineral deficiency, protein deficiency in the body. In Indian scenario, the pancreatitis which is coming, it is more prevalent among non-alcoholic, protein malnutrition and mineral deficiency. So this Ayurvedic treatment, so it is from Ayurveda, but it is fulfilling mineral deficiency. We give a high protein diet, and modern medicine stop all dairy products, but we start from milk, butter, ghee from the day one. And this Amar is a wonderful medicine. It has proven pancreatitis properties. So you Ayurvedic doctors can easily contact us for any pancreatitis patient because you are living in a state which has the highest suicidal rate among pancreatitis cases because they are helpless, because there is nothing to do. Thanks to the organizer, Dr. Jinsi and her team for inviting me today and speak on this subject. Thank you very much and good night.
Thank you so much, sir. There are lots of appreciation, sir, both in the YouTube as well as in the Zoom for your presentation.
My pleasure.
Such a valuable, yes, sir. So thank you so much, sir. Delegates, if you have any more doubts, you can post your questions in the chat box. So we will wait for a few more minutes, sir. Is that okay, sir?
I can, no problem.
Yes.
Please share your YouTube link with me also.
Sure, sir. We'll share, sir.
Yeah, because you will get more viewership after that. I have nearly 9,000 followers. Organic.
Yes. It will be shared, sir.
I can share on my Facebook also. So thank you for your initiative, and I am very glad to meet so youngsters who are so keen to propagate Ayurveda, scientific Ayurveda.
Thank you so much, sir.
And I practice Rashastra. There are other protocols with me. If you need anything from me, because my experience, 44 years of experience, I make fast-acting Ayurvedic medicines for certain diseases. And one of the medicine, if you have read on my Facebook, etc., Imbo. Imbo is a herbo mineral Ayurvedic formulation, and it is the fastest acting effect in the treatment of allergic rhinitis. Within 1 minute, patient respond after swallowing it. So I have many things to share with the people, especially who are keen from Ayurvedic background. It is science-based, evidently effective. and fast acting.
Thank you, sir. It will be a pleasure to take your guidance, sir.
Okay.
Shall we conclude the session, sir?
Okay, thank you.
Yes, sir. Thank you very much, sir. It was really informative session for our clinical practice, and it definitely opened our eyes for the possibilities of Ayurveda in treating slim chance cases like pancreatitis. Thank you all for the patient listening and coming up with doubts and valuable time spent. To know more about our updates, please do stay connected with our social media platforms. There is always light if only we are brave enough to see it, and if only we are brave enough to be it. So let's be brave delegates. That's all for today's most interesting session with lots of new information for us to close our eyes. Thank you all for joining us, and thank you. Thank you, sir.
Okay, bye.
Yes, sir. Good night, sir.
Good night.
Good night.